Hey team, what's up? My name is Austin. I'm 23 years old. I have IBD and I've been to the hospital 3 times for my moderate to severe ulcerative colitis. Not a statistic I'm particularly proud of, but it does legitimize my role as your handy dandy hospital life tour guide for today's video. All right, so first things first, pre-arrival recommendations. Now, short little packing list. You're gonna wanna make sure that you have comfortable clothes. I would recommend like 4 to 5 outfits slash days worth, and it's gonna be sweatpants, sweaters, athleisure, stuff you're gonna be comfortable and mobile in. Bring lots of underwear, ideally your older pairs, because let's just say that you might not always make it to the bathroom, and psychologically, sometimes it's better to just let things go. So third on the packing list, make sure you bring like a calendar or some kind of notepad to where you can write dates and times and important information in. All right, and so finally on the packing list, and the hospital will probably provide some kind of hygiene kit with toothpaste, toothbrush, soaps, and that stuff, but you're gonna wanna go ahead and bring your own stuff just in case. Also include like floss sticks and mouthwash because the kits might not have that. All right, so next recommendation is for the guys out there. So fellas, if you've got hairy arms, you might wanna go ahead and shave them, especially the area around the bend. And I'll explain more about that later, but just in general, if you're a hairy dude, I would recommend shaving as much as possible because you might not always get to shower very often at the hospital, and the goal of the stay is to not feel gross, and so it might better to just... All right, so moving on to the what to expect section, and this was based on my experience, so like I said, probably different at different hospitals, but bear with me. So if you go the check-in through the ER route, you could be in for a long day. There's a lot of preliminary stuff that has to happen in the ER first, and then it could be like a long day of waiting to get a room in the regular hospital. And you know, when you're in a UC flare, this isn't really a lot of fun because the ER is busy and you got to get up and go to the bathroom like every hour and 30 minutes, and you might be plugged into IV, and you know, there's just like EMTs and doctors and nurses and tons of people coming in to talk to you all the time. And so the ER is kind of hectic if that's the route that you go in with. So unless there's like a specific GI floor, you'll likely be put into a wing of the hospital that's just kind of more general patients, probably lots of old people because, you know, of course it's a hospital. So unfortunately, your time in the hospital is a lot of this big like waiting game where basically the equation boils down to, you know, because of X factor, we're waiting to hear back on Y test, which will determine Z treatment or, you know, something like that. So one of the first things that will happen when you get to the hospital is that you will get your IV catheter. Now this will be in your arm for the remainder of your stay, most likely. And now it's used to inject medications as well as get infusions. So such as your antibiotic or your IV corticosteroid. So that'll all go in. It's kind of funny actually. Mentally it takes a second to trust the fact that there is not in fact a metal needle in your arm, but like a flexible plastic tube that you can move safely and freely without rupturing your veins. And also before and after any like injection or infusion, they are going to flush your IV catheter with a saline solution. Now this is pretty interesting because like sometimes you can actually feel the liquid rush into your vein, especially if it's cold. And what's even more interesting is that some people can actually like taste this solution. I can't, but I thought it was cool that, you know, you might be able to. So every day they will likely do a complete blood count, which will check your hemoglobin levels. They'll probably do a metabolic electrolyte count, which will see like calcium, sodium, some of those other things. They'll also likely do a C-reactive protein test, which checks for inflammation. Other tests that might not happen every day, at least they didn't for me, would be like a full kidney function check, full liver check, B12, or like to check my iron. So there's a lot of stuff that they could run, but those 3 that I mentioned are ones that are probably gonna happen every day. Corticosteroids. So early on, you'll probably start some kind of regimen of steroids. For me, it was 30 milligrams a day of solumedrol injected through my IV. This is basically ground zero level therapy for treating ulcerative colitis. Reason being is the steroids are designed to reduce the immune response as well as reduce the inflammation, which should give the ulcers room to heal, therefore reducing your overall UC symptoms. For UC, you'll probably get some fluids, and if your iron is low, you could get an iron infusion, and if your hemoglobin drops too much from all of the bleeding, you could get a blood transfusion, and infusions can take anywhere from like 20 minutes for an iron infusion up to like an hour and a half for a bag of blood, so it really just depends. So if you don't have a UC diagnosis yet, they might perform a sigmoidoscopy to confirm a diagnosis. It'll just kind of check out what's in there, take some biopsies of your ulcers, and both the visuals and the biopsies will help give a confirmation on what exactly is going on inside of you. Now, if you happen to be unresponsive to the corticosteroid therapy, it's possible that you might have to move on to a biologic therapy. My GI doctor considered it to be a rescue treatment because I was getting to be in a pretty critical condition. Now, in order to get started on this therapy, because it is an immunosuppressant, that you have to get some more tests done, like a TB test and a chest x-ray. They just got to make sure that, you know, reducing your immune system isn't gonna just blow you out of the water right there. And now this isn't great news, but for me, the nights were really the worst. So they were just like long, painful, sleepless nights where you get woken up for blood work very early. So hopefully you have a better experience, but the nights for me were really the worst. So this next one is not very fun at all, because if you have a moderate to severe case of ulcerative colitis, it's quite possible that a colorectal surgical team, or at least someone from that department, will come talk to you about the possibility of a surgery that removes your colon as, you know, a way to treat ulcerative colitis. Now, this is not really something that you probably want to think about at all, but if things are continuing to get bad, it's definitely a conversation that has to be had, because you just need to know your options. And finally, at some point, you'll probably have a conversation / multiple conversations with a dietitian, and hopefully they know what they're talking about in terms of ulcerative colitis. And the reason I say that is because diet, in my opinion, is one of the most frustrating parts about this disease, because there is some controversy and some discrepancy between the clinical approach and the dietary approach to resolving issues related to UC. And now that can be between, like, even different doctors can have different approaches, and definitely across the wider IBD community online, people advocate for different diets and have different protocols, and there's not a lot of an agreement. So the information, like getting the right information, is subjective at best. So definitely listen to your dietitian, but also do a lot of research on your own to try to figure out what is going to work for you. Thank you so much for watching this video. I hope you got something good out of it. If you want to check out more of my UC IBD videos, you can check out the playlist link in the description down below, or you can visit my channel. Happy healing. If you're in the hospital, hang in there. You got this. They're going to figure it out. You're going to figure it out. It's going to be okay. Leave a comment to share your experience about what you're going through right now. And yeah, we'll see you guys next time. Take care.